This technique is used to increase intramuscular coordination of a specific muscle. It uses a combination of enhanced motor unit activation, synchronization, and firing rate. Such a technique is used to increase the activation of a specific muscle throughout a full range of motion. It should be performed after the inhibitory and lengthening techniques and is an exercise that can be done with manual resistance like cables, elastic tubing, dumbbells, and machines. Some precautions and contraindications include those special populations, neuromuscular disorders, clients with poor core stabilization strength, acute injury like muscle strains, acute rheumatoid arthritis, and impaired joint motion. The exercises themselves last a frequency of 3 to 5 days per week, with sets of 1 to 2 and a repetition count of 10 to 15. The duration of the exercise is a 2-second isometric hold at the end range of motion with a 4-second eccentric contraction. Alright, Adam, so our first exercise is going to be an isolated movement. We're going to use a resistance band, and it's going to be held against a pole right here. Okay. This is going to help us with some tension. So the first exercise we're going to do is external rotation of the shoulder. So any type of isolated movement can use this kind of resistance, like cables, dumbbells, any machines, or resistance bands. So I'm just going to get you to step a little bit to the side there. So what we're going to have you do is come into about shoulder width apart with your feet. You're going to work to engage your core, that's always important. Bring your shoulders back. You're going to firmly place your elbow right against the side of your body, right inside by your waist here. You want to find tension. Again, the band is going to be about elbow height, so you might have to adjust. You might be a little bit taller than me. You're going to start with your hand across your torso here, and the elbow is going to be flexed at 90 degrees. So can you see this? Mm-hmm. You're going to find tension. Engage that core, bend slightly at the knees. What you're going to do is you're going to begin the movement by kind of almost like a backhand motion here. So it's going to be like this. Right? So the contractions work like this. It's a 1-second concentric, 2-second isometric, and a 4-second eccentric. So it'll look like this, all right? It'll be 1, hold for 2, and then a 4-second count back. Again, working to engage that core, it'll be 1, hold, and 4 seconds back. All right, so always coming back across your torso. Okay. Want to give it a try?
Sure.
All right, so you're going to start with your right arm there. You want shoulder width apart, a little bit wider. There you go. Bend slightly at your knees, engage your core, and you're going to look at a point right in front of you. This arm's going to come across your body right here, and then you're going to come out into a backhand motion. All right, that's your movement, but you want your elbow right against your torso, a little bit closer, and back. And then it's going to be a 1-second motion, hold for 2, and then back, 2, 3, 4, and then come back out, hold, and 1, 2, 3, 4. And then you perform the exercise on the other side.
Okay.
All right? Positional isometric exercises involve isometric contractions performed at the end of the range of motion. It is a static technique with no active motion. Such a movement could be recommended for an individual with adequate core strength and neuromuscular control. The purpose of positional isometric exercises is to increase the activation levels of a specific muscle by increasing intramuscular coordination. Essentially, such a technique is used to target underactive muscles. Some precautions and contraindications include special populations, neuromuscular disorders, acute injuries like muscle sprains, acute rheumatoid arthritis, hypertension, and coronary artery disease. The frequency of exercises is as needed, with sets of 1 and repetition counts of 4. The duration of the exercise itself is 4 seconds isometric holds at 25, 50, 75, and 100%, with 2 seconds between each contraction of rest. exercise we're going to do is a positional isometric. It's about the same motion that we did with the isolated exercise. So with this one, again, we're going to come as close to the wall as we possibly can. We want this left foot up against the wall, making contact the whole time. Slight bend in the knees, engage that core. You're going to bring that position same as we had in the isolated movement. It's going to be a 90-degree angle. We're going to start with the hand across the torso and the elbow contacting the wall, okay? We're going to keep our back straight, contract those abs. What you're going to do is you're going to have a 1-second contraction to get to the wall. Hold it for 4 seconds, and then you're going to come back. Now the key to this exercise is there's different intensities to the contraction. There's a 25%, a 50%, 75, and 100. Okay. So the first one, you're not going to be pressing as hard. This hand can be on the hip or down at the waist. Starting here, make sure you keep contact with that elbow on the wall, 90 degrees. We're going to press against the wall, lightly at first, hold for 4, come back, and we're going to rest for 2 seconds. Then we're going to come back against the wall, press a little harder, about 50%. Again, keeping contact with that body, come back, rest for 2. Then we're going 75, press a little bit harder, and back. And then this one's going to be a maximal contraction against the wall. 100%, press as hard as you can, thumb up, facing the ceiling, contract the abs, bend the knees, and back to start, okay?
Okay.
So I'm going to get you to try. We're going to get that left foot up against the wall, contacting the wall here. A little bit closer, there you go. All right, so we're going to start in starting position. So you're going to take a bend in the elbow, this arm across the body, thumb up in the air, slight bend in the knees, contract the abs, and look at a point right ahead of you. I want you to slowly go 1 second towards the wall, contract 25%, hold for 4, 3, 2, 1, and come back. We're going to rest for 2 seconds. And then I want you to go 1 second back against the wall, hold a little bit, 50%, 1, 2, 3, 4, and back across the torso. Awesome, we're going to rest. All right, back against the wall. This is 75%. 1, 2, 3, 4. Good. Draw those shoulders back. Awesome. Back against the torso. Rest for 2. And last one, maximal contraction against that wall. 1, 2, 3, 4, and across the torso. Again, we would perform this on the other side as well.
Okay.
Integrated exercises are the final component of a corrective exercise continuum. Such a technique uses dynamic total body exercises to enhance functional capacity of the human movement system. The exercise selection for this component of the continuum focuses on synergistic function and mobilization muscles in the body. This technique requires a greater intramuscular coordination with utilization of overhead movements to increase the stress upon core musculature. This technique uses multi-joint exercises in all planes of motion from a bilateral to a unilateral stance. Such a technique helps to reestablish postural control and decrease the risk of injury. Finally, this type of exercise uses low load in a controlled manner to ensure the kinetic chain is in proper alignment. The frequency of exercises is 3 to 5 days per week, with sets of 1 to 2 at a repetition count of 10 to 15. The duration of the rep itself is slow and controlled. All right, Adam, so now we're going to do an integrated exercise to target the shoulder complex.
Okay.
So this is also going to integrate a lower body exercise as well.
Okay.
So you're going to take 1 dumbbell. You want a light weight, whatever you can work most efficiently at. What we're going to do is a single leg squat into a PNF pattern. So I'm just going to demonstrate it for you first. What you're going to do is you're going to position yourself in a contralateral position, which means you're going to use an opposing arm and opposing leg, okay? So you're going to take this right arm with the dumbbell, and you're going to favor the left leg, right? You're going to work to engage your core, start a focal point right ahead of you. You can come down into a single leg squat, and then come up with your contralateral arm and out. Come down, the dumbbell's going to come to the midline of the body, and then back out. I also want you to work to bring this same side leg up into tabletop. So it's going to look like this. Just like that. You can get your balance. And up into tabletop. Alright?
Okay.
So you're going to do a 10-pound dumbbell there. Yeah, so start with point right ahead of you. Don't look down. Engage with the core. You come down to a single leg squat. Right, and abduct the arm out. Perfect. Try again. And back out. And if this is too advanced, you can leave that foot on the ground and just work to favor that one leg.
Okay.
Alright, so try just one reduction, alright? Single leg squat. And come out. There you go. Try one more. And back out. Perfect. Again, you perform this on the other side as well.
Okay.
All right, Adam, so we're going to do our last integrated exercise for the shoulder complex. So for this one, we had to improvise a little bit. We're going to use the step from the fireplace to do an overhead step-up press with a squat. So I'm going to show you first. You're going to take 2 dumbbells at an appropriate weight, nothing too heavy.
Okay.
We're going to face this way. So I want your feet shoulder width apart, slightly bent, engage your core again. Chest up and out. What you're going to do is hang the dumbbells down by your side. You can come down into a squat. And when you come up, you're going to bicep and come overhead, all right?
Okay.
When you come up to the top of the movement on top of the platform, I want you to fully extend your legs at the top. Work to engage those glutes, engage that core, and keep the chest up and out. So it'll look like this one more time. Down, press, overhead, and when you come down, slowly come down one at a time, one leg. Dumbbells will turn, palms facing you, and then come back down into a squat.
Okay.
And you'll do it again. Engage the glutes, slowly step back, and squat. All right?
Do it.
I'll get you to try. Good. All right, so you're going to come down into a squat, keep the chest up and out. You're going to step up onto the platform, dumbbell, up, and press overhead. Engage those glutes, come down slow, shoulder width apart, squat, perfect. Dumbbells up into the chest, overhead, and back down. Try one more for me. You're going to squat, good job, engage the core, keep the chest up, overhead, slowly back down. Perfect.
Ain't it fun?